Hi, my name is Dr. Shailesh. Today we are going to understand what causes the irregular period in PCOS, the prevalence rate of PCOS in India and globally, what is the normal functioning of ovary, and what happens when there is a PCOS in the ovary. Let us understand through the mind map. PCOS in India has been racing like a pandemic. It is almost an 1 in 3 women in the reproductive age are suffering from PCOS. And in the recent journal of an Indian Journal of Endocrinologists year 2017 have stated 36% of an Indians, that is 1 in 3, are suffering from PCOS. Globally, it is 1 in 15. There is also another study done wherein there was a comparative study between the rural area and the urban area, and there was a drastically high prevalence of PCOS in the urban area. A study in 2015 in Mumbai which was done, there was almost near to 23% of cases in the age from 15 to 24 years are suffering from PCOS, whereas in the North India, in the rural area, we can see it is just below the 4%. So there is a drastic difference of PCOS compared to the rural area and the urban area. Now let us understand what are the variation of a period or a menstruation commonly seen in the PCOS female. So first, there can be an irregular menses, 8 or less than 8 period in a year. Second, a menses lasting more than 35 days. Third, it can be heavy or a lighter bleeding per cycle. The second scenario can be a failure to menstruate 3 or more than 3 months at one go. So these are the two common scenarios seen in the female suffering from the PCOS. Let us understand what happens in the normal ovary of a female not suffering from PCOS. Releases few hormones, namely the estrogen, progesterone, androgen, and it releases an egg in the mid of cycle which when fertilizes with a male sperm which is called an ovulation. So these are the normal functions of an ovary which happens in normal woman who is not suffering from PCOS. Now let us understand what happens in the abnormal functioning of ovaries. First is the cyst. In the 90% of cases, the cyst is seen in the sonography. Second is the increased male hormone, almost seen in the 70% of cases, testosterone, which is commonly seen in the PCOS. Third is seen as irregular period, oligomenorrhea, that is irregular menses is commonly seen in 80 to 90% of female. Amenorrhea, that is absence of menses, that is seen in 30 to 40% of cases. The fourth is seen as hirsutism, that is the fine coarse hair on the face, chest and lower part of an abdomen, commonly seen 50% of cases. Fifth is the acne, commonly seen in 15 to 30% of cases of PCOS, that is the hard nodular acne on the face. Sixth is the alopecia, that is the thinning and the falling of a hair, which is seen less than 10% of cases of PCOS. Seventh is the obesity, which is seen 30 to 70% of the cases. Eighth is the infertility, which is seen in the 40% of cases, has an complication in the long-term PCOS. So these were the 8 common things observed in the abnormal functioning of ovary in the PCOS. Now let us understand what causes irregular period in PCOS. The first is the insulin resistance. So what happens in insulin resistance is insulin is released from the pancreas whenever we eat a food in response to the blood sugar. In the normal functioning, insulin is like a key which opens the gate of an cell to absorb the sugar that is released from the food. But what happens in the PCOS is somehow insulin is not able to open the gate of a cell, wherein by virtue the sugars are not absorbed in the cell and there is excess of sugar and there is a persistent release of an insulin from the pancreas, which whereby disturbs the hormonal mechanism, and this lead to the irregular menses in the PCOS. And this is one of the commonest reason insulin resistance in PCOS. Second is the hyperandrogenism, whereby it releases the male hormones such as testosterone. Testosterone disturbs the normal functioning of an ovary, and it interferes in the development and the release of an egg from an ovum, which disturbs this cycle, and there is a persistent increase of an LH surge which disturbs the hormonal balance, whereby leading to the irregular menses. The third commonest cause is anovulation. Anovulation is the absence of release of an egg in the mid of cycle, and this happens in the virtue of an imbalance of an hormone, especially the estrogen progesterone level, and due to the non-release of an egg in the mid of a cycle, this eventually lead to the absence of a cycle or an irregular cycle in the PCOS. The fourth commonest cause is excess of estrogen. As discussed above, in the normal ovary also the estrogen is released, but whereas in the PCOS this estrogen is released in excess of quantity, whereby it leads to the excess thickening of an endometrium lining, and due to which the menstruation cycle is very painful, or there is excess of bleeding, or there can be an irregular in menses. The fifth commonest cause is obesity. See, with the obesity there is a lot of hormonal imbalance of adrenals, DHA, there is excess of cortisol releasing, there is excess of testosterone releasing, and this collaboration of so many hormones not functioning normally can lead to the imbalance of hormone, and which can lead to the irregular cycle. Sixth is the inflammation. There can be chronic mild lingering inflammation in some cases of a long-standing PCOS, and this inflammation in the long run causes the imbalance of an hormone, which can lead to the irregular or an absence of a cycle. Seventh is the genetic factor. An woman or a female born to the already having the family history of an PCOS are more prone to get the PCOS disorder. But it is not only the genetic factor alone can determine the PCOS, it is also an environmental factor, like we have discussed in the start of the video, that the PCOS is more prevalent in the urban area compared to a rural area. So the combination of a genetic susceptibility and the environment can lead to the hormonal imbalance, and which can cause an irregular cycle. The eighth cause is the stress. The stress has been proved efficiently that it disturbs the HPA axis, that is hypothalamic pituitary adrenal axis, whereby it disturbs the hormonal influence from right from the thalamus to the pituitary to the adrenal gland. The hormonal mechanism is disturbed, and which whereby causes the hormonal imbalance and leading to irregular periods in PCOS. Ninth commonest cause is the thyroid disorder. It has been seen that in some cases of the PCOS there is a comorbidity of thyroid known as hypothyroid disorder, which causes the hormonal imbalance and which can lead to the irregular menses. These were the 9 commonest causes which can cause the irregular menses in the PCOS. So at the end of the video, I would like to highlight that PCOS is not only the disease of an ovary or the irregular of cycle, or treating only the disturbed menses or the acne, hair fall, etc. It needs an holistic understanding of everything. It involves the multidisciplinary approach. As PCOS has what we see in the PCOS primarily has an irregular cycle. It is only the tip of the iceberg that we commonly see. At the beneath there it can be many metabolic disorder, obesity, dyslipidemia, hypertension, which is beneath, which is not seen commonly as in prima facie in the cases, especially in the young PCOS female. So it needs an understanding in the holistic way to treat the PCOS. I would like to put forward you one of the famous quote regarding the PCOS is, PCOS is the metabolic syndrome with a reproductive implication, huge impact on the reproductive, metabolic and cardiovascular health of affected girl and woman. It is commonly called as thief of womanhood. I was able to convey the prevalence and the impact of PCOS in current scenario. So we came to the end of today's video. Until we see you in the next video, keep moving forward. Bye for now. Take care.